cases per day was in the high 30s or low 40s. And then that began to be a little bit higher about a week ago. And as of the last week, we are averaging over 100 cases a day, over 100 new cases a day. And just a couple of days ago, we reached the highest number of new cases in the city of Cleveland with over 300 cases. Yesterday was over 180. A couple of days before, a couple of days ago, over 300, and the day before that, 190 something. So you can see this virus is very infectious. It spreads, and it spreads rapidly. And so we are now moving into another phase where we have the governor has executed a curfew from 10 o'clock at night until 5 in the morning, except for essential travel like to work or to the doctor or things like that. And then we had a stay-at-home advisory, meaning that we are advising everyone to stay at home. Stay at home. And if you have to leave only under certain circumstances, again, going to work, going shopping because you have to have food, going to a doctor's appointment, those kind of essential travel needs. And when you do have to go out for those essential travel needs, be sure to wear your mask. Be sure to wear your mask and to keep social distance and constantly wash your hands. In the past, when we began to mandate businesses how they would operate, and we reduced their capacity, required people to wear masks in establishments, it was clear that they were points of contact where people could get infected and were getting infected. But as time has gone on, it seems to have shifted. It shifted into away from it being a business contact into a social contact, where now the greatest number of cases that we're receiving are coming from those who are in some type of social contact in their homes in smaller groups, and or they're having a house party, or they're gathering for a football game, and in doing that, they have not been able or have not done the social distancing. They have not done the mask wearing. They have not stayed at home if they had symptoms, and they've gone out and they've went to other people's homes and they've begun to infect. So that is a very serious thing, because it is harder to manage that. That requires individual behavioral change and individual responsibility in terms to prevent the infection of other people. We find again that the category of people who, in terms of age, who are being infected is usually between 20 to 40 years old. And that group is the group that is, I think, spiking the most. And even though they may have more mild symptoms and may not have to go to the hospital and unless they have chronic underlying illnesses, may not be faced with intensive care or death. But they do go home. They do go home to their parents and their grandparents. And I guarantee you that they will infect their parents and their grandparents, and that is what's happening. And as a result of that, their parents and grandparents are of an age and have chronic underlying illnesses that makes them not only more susceptible to contracting the virus, but also to be in intensive care and also to die. So we have to be mindful of the fact that this is an individual choice behavior thing that we are not and cannot control as we control businesses. We cannot do the same type of control activity in people's homes. So it is individual responsibility. But let me switch gears. One crisis is one thing, but we have another crisis. The COVID-19 and the pandemic and the virus is in the front of everyone's mind and is on TV. It's everywhere. And rightfully so. But we have another pandemic going on, and that is the pandemic of violence in our community. Not just in one community, but throughout the city of Cleveland. There are neighborhoods in the city of Cleveland who have never experienced the level of violence, particularly violent crimes around felonious assault, murders with weapons. They've never experienced it before. And then there are other areas of the city of Cleveland who have borne the burden of crime and violence, particularly violent crimes with weapons. And it's accelerating there also. We have outstripped already this year, we have outstripped the number of homicides we had this time last year. We have outstripped that by at least 45 to 50 homicides, which means that we also have a crisis and a pandemic in terms of that activity. Now, I and my administration and the people who work with me, we've done some things on the prevention side. We put trauma coaches into the rec centers. We've made it violence, and particularly gun violence, a public health issue. We raised the spectrum of the need to create wealth in community and jobs and career opportunity for our young people to give them choices. But those are long-range approaches, and they need to happen in order to eliminate the institutionalized inequities, disparities, and racism. They have to happen, even to the point that we created a new division where City Council passed ordinance last night that I introduced that allows us to create a new division with a commissioner, and that is the Division of Equitable Health and Social Justice. But even with all of that infrastructure that we're putting in place, it will take time to take this thing that is moving so fast and has been moving for generations to turn it around. So that means that we have some immediate problems, some immediate things that need to happen that are basically in the hands of law enforcement, which means that law enforcement now, as it has been, but even so more so now, has to work with our partners on this federal, the state, and the county level in order to address this violence, these homicides, felonious assaults with guns. The availability of guns in our community and the trafficking of them guns, just like you traffic drugs, is a crisis. It does not say that we are saying that people should not have the right to own a gun. That's not what we're saying. But there has to be a responsibleness to that gun ownership. And it has to be a way in which we can stop the trafficking of guns coming into our community that winds up in the hands of those who should not have them, that commit the crimes of violence that are being committed. And that includes people who are legally not able to have a gun, and that includes children and the young people who appears to be the greatest perpetrator of this violence that we're witnessing now. I know questions going to come up about both of these issues. I have the health department here, and I have also the public safety department here to answer questions, to discuss these things with you, get your point of view, and so that we can continue to work on these two major crises that are facing us today. So I'll turn it back to you. And again, I appreciate everybody tuning in for this Tele Town Hall.
Thank you for providing us with that update, Mayor. Now, as a reminder to everyone who's joined us for this Tele Town Hall, if you have a question, all you need to do is press *3 on your telephone keypad at any time to get into the queue to ask your question. A member of our staff will collect your questions. We'll answer as many as we can during this live event. Now, if we do not get to your question, you're welcome to reach out to the City of Cleveland via our social media pages, or by calling 311, or by using the Mayor's Action Center at 216-664-2900. Again, the Mayor's Action Center number is 216-664-2900. Again, all you need to do is press star 3 on your telephone keypad at any time to get into the queue to ask your question tonight. Now let's get into some questions. We're joined now by Elizabeth with our first question. Elizabeth, welcome to the call. You are live with Mayor Jackson.
Hi. Yeah, I read yesterday that the last epidemiologist in the Cleveland Department of Health resigned, and that several have resigned over discrimination and harassment. What are the plans to restaff the department so that we can get accurate data? And also, are you coordinating with the state to secure funds so that people do not have to go to work during the stay-at-home order, seeing as that's also a major point of contact?
Let me take the second part. Yes, we get funding from the state. When they originally did stimulus dollars for the federal government, they sent it to the state. It was very restrictive, which means that we could not have used the money at that time to cover the expense we would have for those to cover the salary of people who would not be at work. And so it became an expense that we would have to bear to a great degree. But since then, they've loosened that up, and as a result of that, we do have money that has come from the federal government to the state that has come to us that has allowed us to fill some gaps in our revenue stream because of the closing down of the hospitality industry in particular, but a general overall economic downturn that resulted in people getting laid off and losing their jobs and not paying taxes, and businesses not having the same profit in the taxes they pay on that. Not only are we doing that in terms of help support our budget so that we could have provide the service and to provide it in a way that keeps our employees safe, but we've also directed money into rental assistance for people to help them if they're laid off and they can't pay their rent. That not only helps them, but it helps their landlord, who many times are just the small businesses that are providing. They own small properties, they rent to people. We have the same money going into homelessness and dollars going into food and various other social activity to help people through this. And then we also are providing dollars for small business that but for that money, they would not be able to stay in business. We are helping them to spend the money they need to create a safe environment, to follow the rules and restrictions that we have set, and we're helping them for that investment, as well as some working capital, because they are businesses that still have overhead and costs, but we're limiting their capacity in terms of customers, and that has substantially cut their revenue. So we're assisting them. So long about answer, but a quick answer too is that yes, we do get money, and we use it in a variety of ways in order to help the entire community. Now, to get to the health department epidemiologist, that is an assertion of discrimination. It has not been determined. Excuse me. It's not been determined, and according to our investigation, has not bear merit. Now, those are still some outstanding open cases that we are going through the process of that, but we maintain that perhaps that did not occur. What we do say through our investigation, that there were things that were done inappropriately, regardless of what race you were, or regardless of what gender you were, or what your age was. And so we have put in place and reorganized the health department and change leadership in order to address that. Now, those people who left, they left on their own accord, and they left on their own accord for whatever reason they stated they left. But that has not hindered our ability to do our job and to fight this epidemic. I will say, however, since we've gone from the low teens up to over 300 cases at the highest in terms of infections per day, that it has put a strain on the number of people who are there. And as a result of that, we have brought in a temporary hiring, hired a consultant for temporary hiring who is helping us bring on people to handle those things we do have to handle, to pull down the data, to do the research on, determine which ones are Cleveland cases, to contact those people, and then to put it into tracing. And so what we are doing now is as we're doing that, is also posting for those who want to have these various jobs like epidemiologists, and we're getting a lot of response to that. And I think we've brought maybe one or two on, and might have another couple in the queue with some others who are other available positions that are open, not just for epidemiologists, but for other people.
All right, thank you, Mayor. Moving on, we've got Callie joining us. Welcome to the call, Callie. Go ahead with your question.
Hey, how you doing, man? I was wondering, hey, how you doing? This Mr. Jackson?
Yes, sir.
Yeah, how you doing? My name is Callie Mitchell, and I stand in a neighborhood where we got abandoned lots, and we got a big school. I was wondering, wouldn't it be a good idea to turn the school Audubon into an apartment building?
That is, I will have to talk to my people, but I believe that there is a discussion going on with the school district as to how they're going to dispose of their abandoned property. And one of the things that we look at, once I think they have the first obligation they have is to offer it to charter schools or to tear it down. And what we have done is we're working with the school district to look at their abandoned property and to see if, in fact, after they've done what they're supposed to do in terms of offering the charter school, what development opportunities are there. And I do know that there are a couple of abandoned schools that developers are looking at, either converting them to apartments or having it torn down and building housing units on that spot. So that is something that is being worked on. I don't know if Audubon, what the status of Audubon is in that process, if there's a consultant, a developer who is interested in that particular site. But I do know what you're suggesting is something that is occurring. I just don't know if it's happening at Audubon.
All right, we're joined now by Barb. Barb, welcome to the call. Go ahead with your question, please.
Hey, thank you, and thank you, Mayor, for having this meeting. Mayor, I do watch the numbers on a daily basis, and so does my husband, and I have had someone die from COVID-19, so I understand the seriousness of it. But my concern
sorry to hear
is
about that.
when numbers are reported, I know several people who have tested positive twice. So are they included, both tests, in those numbers? And I know people who have had a false positive. So is that number included?
Mr. Kimball, Director Kimball, could you answer that question?
Yeah. So if there are two
Identify
cases,
yourself, Mr. Kimball.
Hi, good evening. My name is Brian Kimball. I'm the interim director here at the Cleveland Department of Public Health. And the question is, if a patient tests twice and have two positive tests, is it reported twice? And the answer is no. We count that one case, that index case, once. So we're reporting that first test because we're reporting that first test, counting that first test.
All right, thank you for taking that question, sir. Moving on.
Before you move on, Derek,
yes, Mayor.
She asked, there was a two-part question. One is if you crowned it twice, and there was a second part to that. I can't recall what the second part was.
I apologize. I no longer have her on my screen.
Okay.
And so
Mr. Kimball, do you remember what the second part of her question was?
No, I don't, Mayor.
Okay, if I remember, then I will ask you about it. Go ahead.
And we'll see, Mayor, if we can get her back into the system. So our next caller is Wanda, who's joining us. Welcome to the call, Wanda. Thanks for your patience. Go ahead with your question. Hello, Wanda. Like she's either stepped away or moved on. We'll try and get her back in a second. Carolina, you are next. We've got you live on the call. Go ahead with your question, please.
Okay, my question is, well, they get a new president in the White House, which will be Mr. Biden and Harris. On the internet, they're talking about getting the vaccine out so they can get a lot of people get this vaccine under control. I'd like to know, would that be, how fast would that hit Cleveland for the vaccine available for to get the pandemic under control?
Yes, ma'am. Let me tell you how I understand it. Once the vaccine is finalized and they deem it to be safe for humans to help in terms of preventing the spread of the virus, then there's a certain amount that they may have. Let's say, for instance, they have 40 million doses of the vaccine. Well, in my understanding, that each individual has to get 2 doses. So that means there's 20 million people that can be served by those 40 million doses. And what they do is they are going to prioritize. Now, this is what they say. They're going to prioritize in terms of who gets it first, which would be like your first responders, the people, mainly public safety people, nurses, doctors, those people who come in contact with the public constantly all day long. Those would be the ones that will get the first shot at it. Then, if I'm understanding them correctly, they will then go to those who are most at risk, meaning those who might be in nursing homes or those who are deemed, I guess, by the medical field as being the ones who are most at risk to developing severe symptoms or dying. And then as the time goes on, because it takes them a while to produce the vaccine, as they're doing that, these companies will be producing millions and millions more doses of the vaccine. And then once they cover those couple of categories that I mentioned, then they will offer it to the general public. It is my understanding, again, this is what I'm hearing, that general offer to the public probably won't be until the second quarter of next year, which would mean late March, early April, May, or something like that. And that's assuming that the vaccine gets approved for human use by the end of the year, and they begin to distribute it to the first responders, the hospital people, and the most at-risk people for the first quarter of the year. And then while they're doing that, they'll make more, and then they'll begin to distribute to the general public. Now, the issue becomes, and this is what President-elect Biden is talking about, is that in order for this to be successful and for people to have it to be fair, so it would be fair distribution and equitable distribution, there has to be national leadership in terms of creating infrastructure to get it out. How do you, because even if you have, like, there's 330 million people in the United States. So how do you get to 330 million people and get put an infrastructure in place where you can take the vaccine and get it distributed out to hospitals, to clinics, to the state government, to the state health department, to the county health department. What is that infrastructure? How do you get it out? And when you get it out, how do you ensure that there's a fair and equitable distribution of it so that the people who are most impacted by it become those people who are the first in line? And in this case, since African Americans and minority and poor people are the most at risk because they have the greater likelihood of having underlying illnesses, then what he is saying, the president-elect Biden is saying, is that there should be an infrastructure to ensure that those people who are at risk then become people who become priorities. So that is the way they're explaining it.
Thank you very much, Mayor. Now, for everyone that's joined us on this call, as we made mention earlier, this is an interactive forum, and this is a point in the call where we would love to hear from you. So we've got a quick poll question that we would like to ask. So if you're on the phone, you can vote by pressing the corresponding number on your telephone keypad. Now, our poll question is, we want to know how you prefer to be contacted by our office. Press 1 if it's by phone. Press 2 for email. Press 3 for text messages. Press 4 through social media. Again, we want to know how you prefer to be contacted by our office. If by phone, press 1. By email, press 2. Through text message, press 3. Or through social media, press 4. Now, moving on, we have a couple of online questions. And our first one comes from Mr. Montgomery, who asks, are taking walks outside with a friend, masked the entire time, 6 feet apart, still okay to do?
The quick answer to that is yes. If you're 6 feet apart, you're masked, then you're doing the proper thing, particularly if you're outside, because when you're outside, your chances are better than if you were inside in a confined area where you don't have good ventilation. So if you're in a house or in a room and you don't have a good ventilation, or even if you're in an office space and there's not good ventilation, then wearing a mask and keeping 6 feet or more apart is essential. If you're outside, you're walking down the street with someone and you're wearing them out 6 foot apart and you're out in the open air, that's even better for you. So yes, it's not only appropriate, it's the best thing to do.
Thank you, Mayor. Another question comes from James, and this was submitted online. It's a 2-part question, so we'll take the first part, Mayor. Has the NICE unit, gang unit, and other specialized units been detailed to the 4th District due to the surge in violent crimes and homicides occurring on the southeast side?
Well, before you ask number 2 question, let me ask the Chief to answer that question.
Yeah, Mayor, the answer to that question is yes. We've detailed a lot of assets to both District 4 and District 5. We have a schedule to make sure that all areas of the city get increased responses from a lot of our specialized units, including some of our task force officers and our federal, state, and local partners.
And Chief, before I get to the second part, I think there was some indictments that came down today.
Yeah, Mayor, as part of like our ongoing operations with our task force folks, there were about 13 indictments with both federal and state charges for folks out there committing a lot of the violent crime here in the city of Cleveland. We executed most of those search warrants today and arrested about 2/3 of those individuals, but there's still 3 or 4 out there that we're currently looking for.
And were those people? Were those people? Where did they live? Did they live all over the city, or where?
Yeah, Mayor, they lived all over the city, as well as some of our inner ring suburbs, some of the close suburbs out there near the 4th District. And these folks were arrested for mostly violent crime, gun crimes, robberies, shootings, things like that, some criminal gang enterprise charges as well.
Okay, all right. Part two there?
Yes, Mayor. So the question is, why did it take so long for City Hall to address the terror that has been ravishing our poorer neighborhoods versus the response we've seen downtown during the protests?
Well, I think it ain't taking that long because we stay on it every day. What you have is when you had the protests and the riots downtown, it was a riot, and which meant that we pulled resources from all over the city to address the immediacy of that crisis. It was a riot, and you just can't let people just riot, tearing up stuff. So we did whatever we needed to do at that time, and as a result of that, we only have one night of social unrest, whereas other cities went on for days. Some of them went on for weeks if you went up to Portland. So, and in terms of it taking us long to do the neighborhood, it didn't take us long to do the neighborhood. We're constantly working in neighborhoods, and we'll continue to constantly work in neighborhoods. But I will say to you, there are things that are going on that are adding to the burden that our communities have to bear. Whether you are a poor community, a minority community, or a middle-income community, a white community, it doesn't matter. And those things are associated with the easy availability of guns in the hands of people, not only who should not have them, but they are young people. Very high-powered and accurate weapons in the hands of people who are going about doing things in a violent way that is destructive to our neighborhoods, no matter where you are. And that associated with the environment and atmosphere that is persistent in America now, where there's so much anxiety, so much conflict, so much hatred, so much people being against one another, so much inability for people even to have a decent conversation anymore. When you add those two things together and you put the guns in the hands of children who are immature, then you have a big problem. And when there's money to be made off that, then your problem is even bigger. So if you add drugs in there, you add the trafficking in drugs, you add the trafficking in guns, we have a big problem. And this is a problem not just in Cleveland, all over this country. But we are addressing it, and we do not play favorites. We do not play favorites. If you are committing a crime, we will go to wherever that crime is committed. And if it happened downtown on one day there was a riot, then we dealt with the riot on one day. If it's happening in the neighborhood 7 days a week, we're out there 7 days a week.
Thank you, Mayor. Moving on, we're going back to the phones. We've got Robin on the line with us. Robin, welcome to the call. Go ahead with your question.
Hi, Mayor Frank Jackson and Chief Calvin Williams and everyone else is on board. But my concern, I have lived in Cleveland for over 20 years. I raised my 3 daughters here, but my concern, I have so many, and I appreciate, once again, the job that you all are trying to do. But we have a problem with these homes and a lot of foreclosure homes where the city has taken over and nothing is being done about it, to where the squatters are in there doing drug activity, committing other crimes. And I want to know, what is the city going to do, or what are the steps that will be taken, because it's unsafe. I make building and housing aware of the homes, as well as I'm very much concerned, with the dirt bike boys, all of that, as well as the shooting, and you did address some of that. But people feel with Cleveland that you can do anything, that Cleveland do not care. When people find out, oh, you live Cleveland, And why why can people just get away with all of these things that's being done? And I'm just,
Okay.
so uptight,
Okay,
but I appreciate the things that you are. Okay,
let me talk to you about it. Okay? Well, let me start off by saying those who criticize you for living in Cleveland and saying why you get away with Cleveland, ask them if they come here doing their mess. Because what we find a lot of times is the perpetrators of things aren't necessarily all Clevelanders, and many times the people who control things live outside of Cleveland. The chief has mentioned the fact that some of the arrests, particularly around the organized crime and the drug activity and trafficking activity and gang activity, where people who were arrested in these warrants didn't live in Cleveland. But what they do is sometimes people come to Cleveland to do their mess, and then they go home. Now, that doesn't say the Clevelanders aren't doing it too, but what I'm saying is that when people want to throw that rock, then they need to see what's happening and who's the real perpetrator here. Now, in terms of the homes, Cleveland does not own homes. We don't own homes. As a matter of fact, we do not take abandoned homes. The only time we will take a property is if the house has been torn down, because we do not want the liability of having a vacant home. And like you say, all of that activity goes on. Now, the county land bank, however, will take a vacant home, but in many cases, what they'll do is that they'll find an investor that will come in and repair those homes, and then put them homes back on the market. When you have squatters, it's because you have people who have maybe abandoned their homes, and you have squatters that go from place to place because they don't pay their rent. They get put out, and if they go somewhere where there's an abandoned home because somebody lost it through foreclosure, they'll just go in there and live. And what we find out about it is if the utilities is cut off, and then somebody calls us and says, "Hey, look, people living here, but there's no water in there, there's no electricity in there." And then what we do, we'll go out and we'll address that. If it's an abandoned house that needs to be inspected and it is condemned, then the building and housing department will send it through the process of condemnation and cite the property owner. And because even though the place is condemned, we just cannot go in and tear something down because there is somebody who has a legal title to it. And so there's a legal process that the building and housing department has to go through and go through the housing court in order to ensure that we don't tear down something and then we get sued because somebody said we tore down their property without giving them their legal rights. So that sometimes takes a little while to materialize from the inspection, the condemnation, to demolition.
Thank you, Mayor. Our next caller is Jewel. Jewel, welcome to our call. You're live. What is your question?
I don't have a question right now.
You don't? Why not? Come on now. Tell me something. You don't have no question?
Moving on. We've got Marie now joining us. Welcome to the call, Marie. Do you have a question for the mayor?
I definitely do. How you doing, Mayor Jackson?
I'm doing good. How are you today?
I'm doing great. I want to first of all say I so appreciate how you keep having these town hall meetings, because y'all call me and y'all let me in all the time, and I feel like you really care about what's going on with us as a citizen. I respect the fact that you touched on this violence and all the things that's going on in the city, because these are real issues that we're dealing with every single day.
Yes,
and it makes me feel good so that the person that we elected really does care and really does see the problems that we have going on. Because not only has the violence spiked, but the poverty has spiked. Everything has just spiked. everything.
Yeah.
And all the negatives have come out, and very few people speak on the positives. And I just want to say thank you very much for caring about us and all of your voters and the people who you live next door to.
Well, I appreciate that. I appreciate that. Thank you. Thank you.
And hello to everybody else on the panel. I didn't catch all the names because y'all was saying it real fast, but I know there's other people. Hello, and thank y'all for being here, too.
Okay, well, I appreciate that. I will say that the second part to the lady's question, Director Kimball, was about false negatives, and that do we if there's a false negative or false positive or something like that, and how do we record that, and do we try? How do we do that? I think that was part of. I don't know exactly how she phrased it, but I think it was around some false negative or false positive.
Yeah, okay. Yeah, it was around false positive, false negative. So for those, we don't track those. We receive all positive cases. So okay. That would be, we would refer them back to their medical provider for the testing site for additional testing.
Now, if it came out a false positive, you would investigate that because it came as a positive?
No. So if it's false positive, so what we receive are confirmed positive cases.
Confirmed cases.
So,
okay.
Yeah. So that wouldn't, we would not identify that as a case, and we would not identify that as a case.
Okay. All right. Thank you.
And Mayor, if we can just jump back here to Marie, I think she had a question. Marie, you still with us?
Yes, I'm here.
Okay, and
right,
go ahead with your question, please.
My question is this, Mayor. With the numbers spiking the way that they have been, and I know that no one wants a complete shutdown for economic reasons, but I have personally been tested because I be around a lot of older people. My father, my aunt, all of my immediate family, honestly, are over the 65 or 60-year-old age. So I've been tested, and I know I'm negative. But my concern is and I wear masks, but I've been wearing masks since March before the governor told us to wear masks just because I'm a lightweight germaphobe. But my concern is if we don't shut the city all the way down, honestly, how are we going to cap this resurge? Because I don't think we have enough numbers for us to keep losing the people we have. Our hospitals are already at the maximum capacity. I don't understand. I don't see how we can get through this holiday season, even without us having large gatherings, without us really seeing a lot more deaths if we don't just shut completely down.
Okay. Well, what you're saying would be the ultimate medical approach, which would mean since the virus spreads by contact between people, the way in which you prevent the further spread is to prevent further contact between people. And in that way, those who have it can be dealt with, and then they can go into the treatment that they have, and hopefully they then, when they come out of that and they're no longer with symptoms and things like that, they then will be isolated just like everyone else. Now that is probably the extreme medical solution. What the real issue here is what you are hinting at, and that is you cannot have economic growth, you cannot have economic prosperity, you cannot have the things that we have become accustomed to, or even have the jobs associated with that, as long as there's a pandemic. And not until the pandemic is under control, either through people behaving properly or a vaccine that helps put it in line, will we be able to go back to where we will have a full-blown open economy. And that's a fact. The challenge was, how do we gradually do it without going full open in an economy, but do it in a way that keeps people safe, a safe environment for employees and a safe environment for the customers that may frequent that business or make that product or sell that product. And that only works if people behave properly, which is stay as much out of the way as you can home. If you have to go out, wear a mask, keep social distance, wash your hands. The problem is that people fail to do that. And as a result of that, the issue that you raised is now on the table, not with the state, as to whether or not they will then institute a statewide shutdown again. Just doing it in the city of Cleveland will have very little positive impact on the spread of the virus. It will not. It have small impact. It would have, however, an enormous impact on the economic activity and the loss of jobs. The only way this works is you have a broader, rather than just a city, is you have a broader way of doing this. Now, I was listening to President-elect Biden today, and he has said that he is not going to order an economic shutdown, that he is, however, going to mandate some things that will require people to behave a certain way and to have businesses open and operate a certain way. And that is what he is saying, which I happen to agree with, is the best solution, because you can still control the virus while not completely shutting down the economy. But again, when you have people who don't want to follow the rules, the only way that you're going to be able to eliminate the spread is to completely shut things down and have people isolated. If people follow the rules, then you can have a modified social interaction that will allow for a modified economy that will allow for retaining of a lot of jobs and still keep the virus under control, particularly if the vaccine works.
Thank you very much, Mayor. So I'm just looking online. There are a couple of questions here from different people that I'm going to go ahead and combine into one. So okay. First off, what is the current homicide case numbers in Cleveland, and what are your thoughts on creating neighborhood hubs to get birth and death certificates? This particular person's been waiting since August to get something by form of a birth or death certificate.
On the second point that the person raised, that's a great idea. I'm going to ask my people if that's something that can be done, because of the rise in infection, we're actually paring back our employees back to making them work remotely and only 3 days in person and the rest of the days remotely, which it impacts our ability to get the service out. So that's a great idea. So let me ask about that. Chief, can you speak to the homicide rate?
Yes, Mayor. Right now we're at 159 homicides, and I may be one off because the report we just did it this past Monday, so I may be one off compared to 109 homicides this time last year in 2019.
So you see the magnitude of violence in the city of Cleveland, and particularly gun violence, because I would imagine, Chief, that those homicides, the vast majority of those are because of gun activity. Is that right?
That's correct, Mayor. Out of the 159, almost 160, about 140 of those are contributed to gun violence. So that puts us up about 45% over what we were last year. And to your point, our shootings are also up compared to last year. They're really up about 58%. So
right, which means people were shot. They didn't die, but they were still shot.
Exactly. Our healthcare system saves a lot of these folks that were shot.
Okay.
Thank you very much, Chief and Mayor. It looks like we've got time for one more question. We've got Pastor Debbie joining us. Pastor, you're live on the call. Go ahead, please.
Yes. Hello, and I want to thank you, Mayor. I appreciate these these hall meetings. They are wonderful. And while I'm giving kudos, I would also like to say that I applaud you and kudos to you and to everyone that you've had on the line with you. Congratulations to you, Mayor Jackson, on a fine job. And you show God's love and wisdom. And everyone that you have with you do the same. And I just want to say that I know it looks bleak, but all is well and in great order. As long as we keep doing the things that we're doing, and you keep doing the things that you're doing, and making everyone feel so great. I like what I think her name was Maria said about how appreciation of you and all of the things that you have done and how you have a way of embracing everyone. I think this is great, and just keep up this great job, all of you. Just keep it up. We're going to make it through this thing. God is still in control.
I thank you. I think I really appreciate you, and I really appreciate what you said, and I appreciate all of the questions that people have asked, and I know we didn't get to but a few compared to the ones who are in the queue waiting, but Dirk is giving the mayor's action line, and we'll try to follow up on those that were emailed in. I want to mention, before we close, that we have regular press conferences, and we don't have them like we used to have them, where we have them in person. We have, just like I'm doing a Tele town hall meeting, we do virtual press conferences. It's more like a Zoom video, and the questions are asked through in the same way in which you're asking questions, primarily through text or emails, but it's open to the public, which means it's not just the media there who then can interpret what I say in whatever way they want to interpret it, and then you get a filtered communication. If when we have these press conferences, you can log on to those press conferences. You can watch them, and you can also send in questions there too, and we will address not only the media's questions, but we will address some citizen questions during that same press conference. And you will hear the complete context of what it is that we're talking about there, not just an abbreviated, interpreted thing that comes through the media. So I invite all of you to our press conferences and to our next town hall meeting, and I thank you for being here tonight.
Thank you very much, Mayor. As we do wrap up this call, do you have any safety comments that you'd like to make about washing hands and things to do here during the pandemic?
Well, I always go back to the same thing, and that is they have basic rules, and these rules is for your safety and the safety of your friends and those and your relatives who you care about. That is, stay at home. Just stay at home unless you have to go out. If you do have to go out, wear a mask, keep social distance, and all day long, just wash your hands. Those basic things, those are the basic things that will prevent the spread of the virus the best. And when the vaccine comes and if it's effective, then what will happen is it will allow for people to have a better, I won't say immunity, but a better resistance to the virus, which means they can have more normal social contact in the future. But we haven't got there. But right now, stay at home. Unless you have to go out, if you do, keep social distance, wear a mask, and wash your hands. And for those who are living in neighborhoods where there is violence and crime, particularly gun violence, and for those of you who are become the victim of, remember, you are not forgotten. You're not forgotten. Yes, things have to get better, and yes, we have to do better. But I want you to understand that we have not forgot about you, and you are on our minds, and we discuss your plight and what we can do to assist you on a daily basis. I thank you very much.
Thank you very much, Mayor, for your time and insights tonight, along with your team that joined us on this call. And for everyone that joined this call, we appreciate the opportunity to speak directly with you and to answer your questions. If we weren't able to get to your question this evening, please send us an email, communications@clevelandohio.gov. Again, that email address, communications@clevelandohio.gov. You can follow the City of Cleveland, City Hall, on social media. We're on Facebook, Twitter, Instagram, and LinkedIn. And always remember, the Mayor's Action Center number is 216-664-2900. Again, the Mayor's Action Center number is 216-664-2900. We'll host more of these events in the future to keep you informed on what we're working on and other important updates. But thanks again for joining us during this conversation. We hope you stay healthy and safe, and have a wonderful evening.